Hi, Val. How are you? Oh,
Sorry.
that's okay.
Do you want to? Okay, I'll keep that up.
Oh, so you just want to be careful when you are handling your instruments. Maybe I'll go over a couple of safety protocols for the
Looks
office
like that's a good idea.
with you.
Yeah.
It's good that you're wearing your personal protective equipment, your mask and your eyewear. You just want to make sure that your mask is all the way around your nose.
Sorry about that.
That's okay.
Apologies.
Okay, so the first thing that I'm going to show you how to do here is clean some instruments. All this is in our office safety protocol here, which you can read through, and it gives all the demonstrations of what to do. So first of all, what we're going to do here is I want to recap this needle here because it's sitting out in the open. So what I want you to do is we'll take this, have the cap here, and instead of putting the cap straight back on the needle, I want you to take the swoop technique and put your needle back on like that so that you're not going to injure yourself.
Mm-hmm.
And then what you want to do is remove the used carpule here and put it in the closed container. And then we're also going to remove the used needle here and put that in the sharp container as well so that you don't injure yourself. Okay?
Okay.
And then what we're going to do is come over here. We'll take our long-handled brush because we want to make sure that we don't injure ourselves, and we'll clean all of our instruments here. So you take these sharp instruments, clean them. It's best to clean them underneath the water so that you don't have so much spray coming out. Do you want to try, Val?
Sure.
Here you go.
Thank you. This looks like fun.
So one thing you want to make sure is you want to put it in a cassette and make sure that no sharp edges are poking outside of the cassette.
Why can't the edges be poking out?
Because when you're handling the cassette after, you don't want to cut yourself on the edge.
True. Wouldn't want that. Am I doing well so far?
You're doing great.
Thank you.
Very good learner.
Quick one too.
Mm-hmm. All right, so now what we're going to do is we're going to close the cassette here. Now that we have all of our instruments in there, and we're going to put these instruments into our ultrasonic cleaner here. Place them in there and then put them on for a certain amount of time. And then now we have to clean this.
What's that sound?
Oh, that's the ultrasonics.
Oh, okay.
Cleaner working here.
Good to know. Worried me a little.
Now we're going to take off this sharp burr from this handpiece here
Why don't you just pull it out?
because you don't want to cut yourself.
Okay.
So one thing you're going to use is a pair of Heemstab here so that you can just pull it straight off so that you don't actually have to touch the sharp end. Okay? And then we're going to lubricate our handpiece. And we have to package it. Now I have different sizes of package material. So I think I'm going to use this one because it's the appropriate size for our handpiece here.
Okay, Kristen, that looks good.
Make sure you put it in and seal it properly. And you want to make sure that no parts are sticking out of this package here. And then you can put it. So now that our instruments are finished in the ultrasonic cleaner, we need to sterilize them. So we're going to wrap all of our instruments to make sure that there's no sharp instruments poking out the edges here. And we're going to fold our paper in.
You're a really good folder.
Thank you. Lots of practice.
Mm-hmm. Sure.
And then we're going to take our identification tape and tape it closed. And this is a chemical indicator to show us when it has reached a certain heat in the autoclave here.
A lot of stuff goes in there, right?
Yes, and that's not the right way to stack it, but that's okay.
Well, guess I'm learning from the best.
Oh, so now, one thing I want to show you as well, if you happen to get an injury when you're cleaning instruments and you poke yourself, then bandage it. And then afterwards, you want to go over here to the injury log and you want to write down the date that it happened, the time that it happened, your name, what instrument, and what kind of needle stick injury happened.